Only about 4 to 6% of people who are seeking some sort of complementary and alternative medicine actually leave conventional treatment and care to go find another therapy or practice for which we have no evidence to date to say that it actually does what it's supposed to do. Most people use some form of CAM or complementary medicine in a complementary fashion together with their conventional treatment and care. Another big myth is that what's good for one person must be good for another. And probably many of you have experienced already well-meaning family and friends who have offered bits of advice, information they've seen on the internet, or perhaps some CAM therapy that their aunt or friend had used that achieved some sort of good results for that person. And while those well-meaning family and friends are really trying to be helpful, we want to point out that what worked for one person isn't necessarily going to work for another. There's different kinds of cancers, and people in general are complex. So we want to be careful about taking advice from one person and applying it directly for another. We want to really take that information and look at what's the evidence behind it, how is this CAM therapy going to be used, and what does it mean for you as an individual with a particular kind of prostate cancer and other health conditions and other things to think about that are right for you. Another really big myth around complementary medicine is that if it's natural, it must be safe. We often hear conventional cancer treatments like radiation, chemotherapy, and surgery are toxic and harmful to the body, and that complementary therapies, natural health products in particular, tend to be safer. And in fact, the opposite may be true for many people. We want to think about complementary medicine just like you would think about any type of medication. You really want to know what's in the medicine, how well does it work for a particular condition, how well has it been studied, what's the evidence around it. And if it hasn't been studied, we need to think about that in terms of not having the knowledge about how helpful or safe it might be. Another myth is that more is better. In our daily diet, there's a variety of phytonutrients, vitamins, and minerals that are optimal for our body, even when we have cancer. Although you may hear a lot of advice and information about the use of high-dose vitamins and minerals, generally this is not recommended while you're on cancer treatment.